How's everyone doing? Hey, hey, hey. Let me open you up on my computer over here. My name is Whitney, and I am a registered dental hygienist here to talk teeth live from Chicago. It's Monday night. Okay, I just put lip gloss on, and I already got my hair in it. Okay, so I'm so excited to do these when I'm off. Let me know if you could hear me. You could hear me, right? I hope you can hear me. Who's in here? Hear me. Hello, hello, hello. You can hear me, right? Oh, making sure I always am an audio nervous person because you never know if you can hear me or not. Yes, Brandy said yes, thank you. So I'm on winter break from school, and anytime I'm on a school break, I really try to do more of these YouTube live streams because I'm on school break, so I have some extra time, and I love doing these to talk with you all who have been following along. It makes me so happy to hear what y'all got going on, what kind of questions you have. You just want to tell me a fun fact. I love reading these comments. I try, sometimes they go really fast. Just depends how many people end up joining. But I try to read all the comments afterwards. So like if I didn't get to see it during, I'm going to read it after, you know what I'm saying? Someone just said, I just started binge watching your channel last night. It's the best. So grateful for the education. Thank you. Thank you. It means so much more than you know. So I thought I froze. Am I frozen? Don't tell me I'm frozen. Come on, come on. I look frozen, but I feel like, are we okay? I don't know. Are we okay? Oh yeah, they're all coming. Oh, they all came. Okay, there's all the questions. Hello. Okay, I love your channel. Thank you so much. Can you ask mouth question? I have this weird taste on my tongue. What kind of taste? Tell me more about that. Hi, my friend. Hello, James. Someone asked how they can regrow their gums. I'm just gonna start right in. So also don't forget to use the super chat and the stickers. It adds the fun, right? It adds to the fun. There's so much fun stuff on YouTube here that you can do in these live streams. I'm trying to see. Let me just make sure. Hold on. I got the gums question. Regrow gums, really good question. Then someone else has something about their metallic taste in your mouth. You know what? There's some interesting random things that can cause a metallic taste. It can be allergies. It can be like, I guess what I'm trying to say is there's so many things that can cause it that are not dental related. So it's like really hard for me to speak on a taste in your mouth. But if it doesn't go away, my best advice is to call your individual dental provider. A few days ago. Oh, you had it a few days ago. If it went away, you know what I mean? That's something to probably tell them at next appointment. But if it's not going away, it could be new medications you're taking. Maybe you just ate something different or weird, or there's so many weird things. But if it happens chronically and it keeps happening, definitely ask at your next appointment. If it's concerning you, call to make an appointment sooner than later, Okay, I hope that kind of helps you, Brandy. I have so many follow-up questions on that. I'm just jumping right in. Okay, next question I saw was how to regrow your gums. Someone asked about that. So the thing with regrowth, it can't really happen. Like was it gums or teeth? Wait a second. What was it? Was it gums or teeth? What do you want to regrow? What are we regrowing? My gums. Okay, never mind. Sorry, I was thinking teeth. Well, either way, we'll answer for both gums and teeth. So gums, it depends, do you have bone loss? Is that why you have some gum recession or the gums are receding? Or do you have punched out papilla where your gums are totally missing? So, there's different severities of types of gum disease and types of periodontal issues. So the best way I would say if you're having gum problems, number one, oral hygiene is key. So oftentimes the gums go back because there's a lot of plaque or tartar on the teeth, and then they start growing back. That's the number one cause of gum recession. So we want to, there's more information to this. After my deep dental cleaning. Okay, perfect. So that was what I was going to say. Get a good teeth cleaning, keep up with your home care at home, get rid of all that stuff that's stuck on the teeth, and that will help the gums kind of bounce back to where they were. If you already had your deep cleaning, your SRP, good oral hygiene at home is key, right? Don't skip a day. Brushing, flossing, routine, 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 and visiting your dental office routinely. Don't forget to keep up with your appointments, because oftentimes after a deep cleaning, they will have you come in every 3 months instead of every 6, so they can just keep up with not letting that stuff go back to your gum line, right? Or else your gums will be angry again and keep going down. So for them to come back up, keep them as clean as you can. And if after so many appointments, talk with your dentist, talk with your dental hygienist, if they're still not where you want them to be, there are depending on the severity, there are different procedures you can do, like gingival procedures, gingival surgeries, to help kind of replace the gums where they're lost. You could put new tissue there, but that's like very extreme, and definitely try all the other stuff first. So I hope that helps. They said dental floss will make worse your gums. No, dental floss will not make your gums worse. Here's the thing. Everyone's different. I don't know your specific situation. If you had gum surgery, they might tell you certain things to do after that surgery until they heal. Maybe they want you to use a different interdental cleaning method. Maybe for you, a water flosser works, or an interdental brush, something to clean between your teeth. Maybe you're unable to use floss correctly. Is that why they said it to you? I don't know. But I guess my point is, just see what their individual advice is for you, and that'll help you a lot. Someone else asked me how many years. I hope that helps. If you have any further questions, please DM me on Instagram, talk with me on Instagram, and I will hopefully give you more details, like resources that you can go to with more details of my videos that give generalized advice. But again, talking with your individual provider is key. Someone asked how long, what was it? How many years did it take to study for your career? So in the USA, it takes 2 years of dental hygiene school plus 1 to 2 years of prerequisites at minimum to become a dental hygienist. So it'll take 1 to 2 years before dental hygiene school, and then dental hygiene school is 2 years. So it's usually around 4 years. Some people can get it done in 3, but more often than not, it's going to be 4 years, and that's for an associate. If you want to do a bachelor's degree, that's going to take 4 years, and then it's a bachelor's degree versus an associate. But it's still, like I said, the associate's going to be around 4 years anyway. The difference between bachelor's and associate, the bachelor's is going to be a lot more expensive, and the associate's going to be a little bit more affordable. So if you know you want to work clinically, chairside in the op, cleaning teeth, but what we know as a traditional dental hygienist, go for the associate, right? Because like, why wouldn't you? It's cheaper. But if you think you want to do anything further after that, like you can always get your bachelor's later. So don't worry about it. But if you know you're going to want to teach, like be a dental hygiene instructor or do research or work in marketing or sales, or if you're going to want to do something other than the traditional chairside career, then consider the bachelor's, because you're probably going to need to get it anyway. You know what I mean? But if not, if you know you want to work in that chair, or not in the chair, on the people in that chair, associate's cheaper. So I hope that helps you. But so what I did, I went backwards. I got my bachelor's first, not in dental hygiene. I thought I was going to be a dentist. Long story short, I decided dental school wasn't for me. I never even applied. So I have a 4-year degree in biology, and then I got the 2-year degree in dental hygiene after. So I went backwards. A lot of people do that, and that works too, because sometimes you find out when you're observing the dentist, you realize, wait, I'm more interested in what the dental hygienist is doing over there. That's what happened to me. And so it all works out. Okay. What order? Brush. Bethany asks, brush, floss, water floss, mouth rinse. Okay, Bethany, you're doing all the things. I don't care what order you do. So this is what I tell my patients. If you are doing all the things and you're using the proper technique with all the things, don't matter what order you do, except like brushing and flossing, don't matter, whatever order you prefer. There's like no research to really say one is better than the other going first or second. But I will say, if you're going to use mouth rinse, if you're using any kind of anti-cavity mouthwash, that should be last. So you do all your stuff, The anti-cavity mouthwash should be last, because you want those anti-cavity ingredients to sit on your teeth overnight when you're sleeping, right? So you don't want to wash them away with the brush or wash them away with the water flosser, right? So I hope that kind of helps. And if you don't use a mouthwash that's anti-cavity, if it's just like an antiseptic or a fresh breath, or you could use it before It don't matter as long as you're using proper technique. Hope that helps. Okay. My hair keeps getting in the way. We got lots of beautiful. Oh, look at all these emojis. Y'all sending emojis. I don't even know what this is. I love it. These YouTube emojis hit different. Don't they? Oh, I can't. I'm trying to slide in closer to you all so I can read this. Because I usually have it on my screen over here, but that one's not working. So I'm looking right up on my phone. Okay, what do we got here? Among Us. There's a lot of just random. Oh, someone said thank you. You're welcome. I want you as my dentist. That's so nice of you, Ben. I'm not a dentist, though. I'm a dental hygienist, but I would always love to see everyone that I talk to on social media. I would love to be your dental hygienist as well. I think it'd be so fun to meet people in real life. But for now, virtual is as good as it's going to get. But maybe one day we can do a live event, which would be amazing. We can all just like smile and take photos with our teeth. Gonna have a good time. Someone asked Team Fluoride or nano-hydroxyapatite. Bethany, I'm Team Fluoride. So I have a bunch of videos on this. Before anyone gets mad, I know it's like a controversial thing. It doesn't have to be. So I have a bunch of videos if you want to see all the research and all the sources. I link everything in the bottom bar description box of my videos. But the reason fluoride toothpaste is better than nano-hydroxyapatite toothpaste is because when your mouth has a very acidic environment, acids are what increases your risk of cavities, right? We all say like eating sugar and, eating all this bad stuff. It's not the sugar that causes the cavities. It's the bacteria in your mouth that eats the sugar. And then the bacteria, after it eats it, it secrete like acids on your teeth. So we say the sugar bugs poop on your teeth. And that poop or those acids, that's what increases your risk of tooth decay. And fluoride toothpaste, when you're using that, it works better in more acidic environments by 1 pH level than nano-hydroxyapatite. So if you are cavity prone, fluoride toothpaste it's proven, research shows, to do a little better of a job. Having said that, nano-hydroxyapatite is so new and we just don't know too much about it other than like the biology of it, what I just said, the pH levels and how it acts in acidic environments. We don't have too much research. Like fluoride's been around for like 75 plus years as an ingredient in toothpaste. So we got good research on that, right? Over 75 plus years. But with the nano-hydroxyapatite, it's much newer. So we just like don't know. It looks promising. And then long story short, I just saw someone say, how does she know all of this off the top of her head is amazing. That makes me so much. Thank you for saying that, because sometimes I really feel like I'm going slow to make sure I'm saying everything correctly. I've made so many videos and to make sure. So thank you. Who said that? Calvin. Thank you, Calvin. Thank you. I don't know everything, but this one I know because I do speak on dental health misinformation on social media. So this stuff comes out a little quicker than if you ask me about like, I don't know, I'm trying to think of something like cold sores and canker sores. Like I don't know every single thing about the biology of that, like right off the top of my head. I know like the basics. Anyway, so back to the fluoride toothpaste. That's why I like it. It's proven to work, right? It's the gold standard right now. One day maybe nano-hydroxyapatite will be just as good. It's the second best from what we know, but it doesn't have an FDA seal of like there's no FDA approval. There's no regulatory body that approves it, like the American Dental Association. So without these regulatory approvals, this is the issue I have. The nano-hydroxyapatite toothpaste, from what the research says, looks great. But when people are selling you this nano-hydroxyapatite toothpaste, since there's no regulations, there's no standard organization making sure that the bottle, if it claims it has nano-hydroxyapatite toothpaste or has that ingredient in it, there's no regulatory body confirming that it claims what it says. So some people can sell toothpaste and say stuff's in it, but without regulatory approval, they don't need to prove that it's in it. Marketing, advertising, you could write whatever you want on a tube of toothpaste or the box of toothpaste, unless it has an FDA or an ADA or some kind of, depending what country you're in, regulatory body of a health organization gave it the stamp of approval. You don't really know it does what it claims. So that's the issue I have. There's just no regulatory stuff going on. I hope that makes sense. I know I like said that a million different ways. I just hope I tried to say it different ways so you can kind of get what I'm saying. Did you see that? I think like a light went off, but all my lights are on. Did you all see that? Please tell me someone saw that. Okay. As you all, maybe someone will tell me, did you all see the light flicker back there? If not, no worries. Please tell me though, as I answer this next question. Someone said, I wonder how tall she is, LOL. 5'8". 5'8". 5'8". Okay. Okay, hi. I don't like needles. This is Anthony. A lot of people are like, you don't worry about that. Do they have modern technology now to numbing your gums? Anthony, great question. So yes, there are a lot of, I don't want to say technology. So here's the thing. Oftentimes I've been seeing more and more comments on my YouTube videos that say like, ow, I felt the needle before my filling or my crown. I felt them put the needle for the numbing and it was awful and blah, blah, blah. And I'm like, wait, what? Why are you feeling the needle? Because most offices will use a topical gel first. That's what we use. And that's what I was taught in school. So I'm not sure what areas or where this isn't happening, but they should use a topical gel, which is like a benzocaine or like some kind of topical, gel is the best word. And they numb the area with this gel before they put the needle in. So you shouldn't feel the needle. It'll just feel like someone's like touching you. You'll feel like a pinch, but it won't. And this is my advice to patients who don't like needles. When I am doing like an SRP, a deep cleaning, and I need to numb them up, sorry, I keep touching my hair. Oh my goodness. If my mom's watching, she'll be upset. She's like, stop touching your hair. I'm sorry. I can't stop it. I need to stop it. Okay. Back to the needles. Yes. So I tell my patients, if you're scared of needles, I'll let you know when to close your eye. Like close your eyes. Don't, because I don't want you, I like hide it like back under, like I'm holding it low. I'm like, okay, close your eyes. And then I'll go in and do it because you're already kind of numb and you won't really feel it. So let them know. My advice to you is if you're a little nervous about needles, let them know so then they can tell you when to close your eyes. And I swear it really helps. When you don't see it, you won't feel it like that because you're not seeing it and you're already a little bit numb from the topical. Oh, sorry. You asked about technology. So technology, there are certain things like, I forgot what there's this like vibrating wand. Someone, if you're in the dental world, let me know what it's called, but it's some kind of vibrating wand. I know they sell it and it like you put it like in your cheek, wherever you're about to do the injection, and it like vibrates. So you don't really feel the injection because you're busy feeling the vibrating. I don't use a wand. I use that technique with my finger. I like grab your cheek and I go like that while I'm giving the injection. So all you're doing is feeling me grab your cheek. So there's like different techniques. So I guess my point is, again, just let them know you're nervous and be like, do anything you can so I don't feel it. And then they will, if they weren't going to already. You know what I mean? Most of us just assume people don't like needles, but I hope that helps. Did anyone ever answer about the light behind me? Did anyone see that light happen? Because I kind of need to know. It's okay if not. But what do we got? Ooh, we got some long ones. Okay, let's see. Excuse me. My nose. I just had hot wings. Is that what I had? Are they called wings? Alex, my husband, made me some wings before this. Thank you. They're very good, but a little hot. I had some almond milk with them. It's good. All right. Let's see. What is the cost of one implant without insurance? Depends. So anything in dentistry, it will vary the price depending on like cost of living in the area, just the area in general. If you live in the city, if you live in the suburbs, if you live in a very rural area, like urban versus rural, there's so many different factors that goes into, you're welcome, Anthony. Thank you. I hope it helped. There's so many different factors that go into pricing. So it's hard to give an average, right? I would say I do have on my website, teethtalkgirl.com. You can always go to my website. There's a cool search bar there. And, you can type in like insurance or what was it? Oh, implant price. and it'll pop right up. Or even like on Google, implant price teeth talk girl. I have a whole pricing list of like different areas and different, so you can really get a better estimate of what it would be in your area. But implants are pretty pricey. If I were to guess, now this is who, oh my gosh, my nice person earlier who said I know things off the top of my head. Pricing's definitely not something I know. My guess, it's like around 1,700 to 2,500. That'd be my guess. I'm gonna check later and see if I'm right. For the implant itself, that's just the screw that goes into your oh, see, someone just, hold on. My dental implant for a single is around 2,000 where I live. See, okay, so 1,700 to 2,500 wasn't too bad, but that's usually just for the screw. And you have to keep in mind there's also gonna be an abutment, which is the little part that attaches the screw from in your jaw to the crown that's gonna go on top. And the crowns are usually around 1,100 to 1,500. So altogether, it's a lot, but I will say it is the best tooth replacement option there is. If you are missing a tooth and you want to replace, the missing tooth, if you want to fill in that gap, a dental implant is modern times the best option available. It won't even look like it's a fake tooth. It'll look real. No one will know but you and your dental provider. It'll feel the most similar to a natural tooth because it doesn't come in and out. It's just there see, Jenkins, you know it. It's worth it. It really is worth it. It's quite an investment, but I will say the other options, I sound like I'm like trying to be a salesperson for implants. Believe me, I get nothing out of this. I'm just telling you my experience as someone who's worked in dental for a long time. The patients who get the implant, they're always happy. Do you know what I mean? Like, it's very rare for someone to not be happy. Whereas if someone's getting a bridge or a partial denture or like all these other tooth replacement options, more often than not, they come back because they're unhappy with it. Like the partial denture doesn't fit properly. They need to get adjustments. They don't like it because they have to take it in and out at night, or bridges. Maybe bridges are very expensive, by the way, and you don't save that much money getting a bridge versus an implant. So look into that. If it's only a couple $100 of a difference, do you know what I mean? Consider the implant. Because bridges could be good, but for a bridge, you have two teeth and then the tooth in between it is missing. So you're putting a tooth there to cap it. Don't worry, that's not my middle finger. That's my that's my pointer. You're putting a tooth to cap it, and then you also have to cap these two teeth around it. So these teeth that weren't unhealthy, you have to shave those down to put this one in between it. So now you it's not very conservative, right? Because you had to kind of mess with the two healthy teeth next to it. So that's my long spiel as if you can get a dental implant and it's an option for you financially, it is the best replacement investment there is. The other ones are going to end up being just as expensive because more likely than not, you're going to be unhappy with them. Not always for a bridge, but definitely for a partial. Someone said smash. Makes me think of Mario World. I went to California a couple months ago and it was like Mario World. Is that what it's called? I don't know. Yeah, Mario World. Maybe it was called something else, but it's in Universal. And when I just saw Smash, it made me think of that donkey guy, that Donkey Kong. I don't know what I'm saying. Okay, anyway, that's what I thought. Someone said hi from England. Adam, it's 1:22 a.m. Thank you so much for being here. I went to England once, and it was awesome, and I want to go back because we did a really quick trip there, so we didn't get to see much. It was like a couple days only, and we were like going through. We went to London. We went a couple places, but I would love to go back. I love it. Hello from England, and I hope to go back one day. And also, I feel like I live the European, I like when I go to Europe, I feel like I'm very happy on that time zone. And then when I come back here, I'm like never happy on this time zone. I don't know. I like Europe a lot. Let's see here. What do we got? Someone says, sorry for the long story. Never be sorry. Never be sorry, friend Sarah. Everything I say is a long story. I just got an x-ray today after a strong ache in my tooth the past few days, but my dentist says he can't see anything. I swear there's a cavity though. Any advice? That's the worst, right? When you're like, I don't want a cavity, but I want to know what I'm feeling, right? Like I get it. My advice is Well, I'm curious what he told you, because oftentimes when someone's having an ache and we don't see anything on the x-ray, oftentimes it's from clenching or grinding. I'm assuming your dentist told you that as well. Like maybe at night you're banging on a specific tooth or teeth and that's why it aches. Like, are you clenching or grinding really? Like, does your jaw hurt in the morning? Usually I would ask if you're a clencher or grinder, because like maybe you've just been banging on it and it's like bruised in a sense, right? Imagine your teeth going like that all night, and then you wake up and now it's hurt. That's an option. So I don't know if they talk to you about wearing a night guard or anything. It doesn't always help with pain, but it will prevent your teeth from chipping, or, if you are clenching or grinding. And then of course, whatever else they told you. And then if you're really not getting answers and you really are feeling uncomfortable, you can always get a second opinion to see another dental provider in the area, just to see. It can't hurt. I'm not dismissing your dentist, you know what I mean? But if you want to confirm there's nothing, it can't hurt to ask another person just to confirm. Doesn't mean you can't go back to your dentist if you like the person, but the original one. But that's my best advice. But yeah, usually it's clenching or grinding, but I'm sure they told you that already. Ooh, someone said their dentist made them custom mouth guard for sleeping, night guard for sleeping. It was pricey. That's a very expensive price. They said it was $2K. Usually they're between like $400 and $600, I thought was the average dollars, but maybe, depending with insurance, without insurance, silly insurance, right? I will say, insurance isn't the only answer. Okay. Like a lot of people I just made a video on this. I didn't post it yet. Because I'm in the editing phase still, but I made a video long ago that was all about like what to do if you don't have insurance, ways to get care, dental care in the US. And it was really like access to care for low income individuals. Then I recently made a video, I didn't post it yet because I'm still editing it. It's all about like if you don't have insurance, but you wouldn't consider yourself low income. You would just consider yourself someone who doesn't get insurance from your job, or you're doing okay, but you really, you know what I mean? You don't really qualify for any of the low income stuff, but it's still going to be hard financially for you to see a dentist. So for that group of people, I just made a video, which I hope helps on, it is an option in my low income video, but it's also going to be the main option for this video I'm talking about, when it's basically you just don't get insurance from your job. There's something called dental discount plans. They're so great. I have a video. If you want to learn all about them, I will talk forever and ever about them, but it's basically like, it's kind of like an insurance, but not. It's a discount plan, but you can just like buy it on your own and it discounts everything at the dentist. The only like thing about it is not every dentist accepts it, right? So you have to look on the list and see who accepts it in your area. But those are so great. And I get messages every day on YouTube and Instagram saying like, thank you, Whitney, for telling me about dental discount plans. I finally got to the dentist because this made it more affordable for me. You know what I mean? So search dental discount plan or dental insurance, teeth talk girl at the end, dental insurance, dental discount plans, teeth talk girl on Google or YouTube, and it'll pop up and it'll give you all the information you need. So I hope that helps you. Yes, Karima said dental insurance isn't really insurance, but a discount plan, 100%. And that's what I talk about in my video. Like, don't feel bad that you don't have dental insurance because it's really not that good. Some are okay. They give you a pretty good annual maximum, but most of the time, you gotta really, is it even worth it? Unless you're getting it through your employer, So that's why those discount plans, getting them yourself, they're so much cheaper than actual insurance. And anyway, somebody asked me if I've been to Canada. I have 2 or 3 times. So I've only drove there. I didn't drive, but I was in a car. We drove over the border to like do like a camping, I don't want to say camping, cabin. It was a rustic cabin life. I've never been to any of the big cities in Canada or anything. I've only been like right over, I think we passed over, what's it called? Mackinac Bridge? Yeah, that's what we drove over, Mackinac. So I loved it. It was cute. I think we were in Lake Erie. Am I saying things right? This is not a geography channel. This is a dental channel. So if I said that wrong, but I think it's right. Yes, I loved Canada. I would love to go back. I met a bunch of people at a wedding once. We went to my friend's wedding from college, and a bunch of her husband's family was from Newfoundland. And made me really want to visit Newfoundland. I was like, whoa, they were all so fun. And like, I was like, I want to come visit you all. So that's when I want to go to all the big cities and all the, Anywho, okay, let's see. Christina, your channel gave me the courage to finally go back to the dentist. Now my teeth are so healthy. Thanks for helping me overcome some major anxiety, Christina. Thank you. This is why I do what I do, because like it's true. Once you make the first step, right, it gets easier. And once you find a dentist and a dental hygienist, dental providers that you align with and you're comfortable with, doesn't it get easier? So I'm so happy to hear that. Wishing you continued dental health and continued dental care. Thank you, Christina, for being here and for saying such a kind thing to me right now. That's really, really nice. Someone asked me how my teeth are so white. I will tell you, I got a ring light right up here. So the light makes them look whiter than they are. They're not white, but they're not this white. You know what I mean? Like, if you look up close, oh my gosh, there's food in my teeth. I just had a lemon cookie right before. Well, you can't even see it. I bit like part of it, and it's definitely my tooth right now. I would be on a dental live stream. I have a good tip for this, actually. Look at this improv right now. Impromptu. I had a friend, Noelle, shout out. We were in a car once. It was a whole thing. Long story short, she was like, I did have floss, but we didn't have access to it because we were on a road trip and it was a lot. We had a baby in the car. There was stuff going on. And she was like, oh, I want to get this out of my mouth. What do I do, Whitney? She's trying to pick it up. I was like, here's the tip. If you have something in between your teeth and you don't have access to anything right now, like floss or a toothbrush, drink some water. Can you hear how hard I'm swishing? You just got to swish so hard. I don't know. Oh, no, it didn't get it. But sometimes it gets it. Hold on. I don't think I got it. Well, sometimes it works. I will say it worked for her. And she was like, whoa, you really do know your stuff. Like she was joking like, wow, you really are a dental hygienist. Because oftentimes the water really swishes it. Am I about to do something crazy right now? I am. I have floss over there. Hold on. Hello, everyone. Just me getting some floss. Hold on. You could all floss with me right now. How wild. I'm opening this because it was there. Oh my gosh, this is real life right now. I never do this. Usually I'm like really planned. Is it still there? Yeah, it is. I can't continue this. Okay, I took it away for people that don't want to see that happen. Now you swish. Go on. Right? Yeah. All right, thanks for joining me on my floss talk. Okay, raise your hand if you were grossed out, or I don't know, maybe not. Raise your hand if you were satisfied. I'll just get all the hands raised. Whether you were grossed out or satisfied, raise your hand. All right, let me see. Oh, I haven't been scrolling because I ran over there. Okay, people saying satisfied. Thank you. Okay, now I got to see what else we got going on here. How often do you do live streams? Great question. I try to do them on every break from school. So like right now I'm on winter break. So I'm going to try to do spring break, probably early March. So I only do them I shouldn't say a couple, like every other month, because I'm always on some kind of break. So come back. But every other month, I guess March is in like 3 months. There's no really good schedule, but randomly, and I always set this like what we do. I set the premiere, or it always like notifies you if you're a subscriber that I'm gonna do a live stream, so it'll tell you when my next one is if it's coming up. So, but thank you so much for being. I hope you enjoy these live streams because I do. It's so fun to see what you all are asking. Okay. Someone just said keep going. Okay. Woo! Someone said woo. Okay. I love going to the dermatologist so much. Okay, I love that. Do you think a Xylitol cookie would be good for your teeth? Are there Xylitol cookies? I guess there could be, because Xylitol is like a sugar sweetener, or sugar substitute, or whatever you want to call it. Just a sugar alcohol, technically, right? I guess there could be, but no, it's still not going to be good, right? Because yes, the sugar might be a little better, but all the other stuff that needs to be put into a cookie, it's all about the carbohydrate part of it, right? Look at all these layers of breading, getting that gunk stuck in your teeth. Whether it's healthy sugar or not healthy sugar, there's still gunk in your teeth. And whether it's going to create a cavity or not, it's going to irritate your gums because something's stuck. So I hope that makes sense. Now, I always say things like, That's something I wanted to answer on my AMA. I just didn't ask me anything on Instagram, and I didn't get to ask. I didn't get to answer all the questions because I wanted to jump on here. But I did see someone ask, why don't dental providers promote not eating carbs as a way to prevent cavities? And I wanted to. Maybe I'll reply after this then. And what I would have said is, I don't think we, like dental providers, I don't think we don't do that. We tell you carbs and sugars are bad, but I think just like when you look at statistics and research on like how many people aren't brushing every day, how many people aren't flossing every day, it's much easier to, from a public health perspective, or even from a one-on-one patient provider in the op, it's much easier to say, hey, we should be implementing brushing twice a day before we start talking about huge diet changes. You know what I mean? Like a 30-second change or a 2-minute change, depending on if we're talking about flossing or brushing, to add to your routine, or a full-out diet change. Obviously, adding in a 2-minute brushing session is easier than changing everything you eat. So I hope my answer, if you're listening, makes sense, in the sense that hope I'm making sense to say it's all important. Cavities are multifactorial. There's all these different things that go into it. Poor diet, poor dental health, poor dental hygiene, bad saliva, right? You can have a really acidic saliva, genetics. Sometimes you're kind of born with it. It doesn't mean you're doomed, but some people just have the bacteria. Stuff happens in your mouth. Microbial stuff happens in your mouth different than other people. So there's a bunch of things that go into cavities and why they form. So I don't know. Hopefully that answered that question. Nobody even here asked it. Somebody asked it on Instagram, but maybe you're here too. And now hopefully that helped you. Thank you. Okay. Let's see what else we got. Is there a vitamin we can take to have stronger teeth? Lizzie, all the vitamins. I will say, I made a video. So no, don't take vitamins for stronger teeth unless your physician tells you otherwise, but eat foods rich with certain vitamins, like carrots, or I'm trying to think of all the foods that are really healthy for teeth. Carrots, apples, honestly, all the healthy foods that you hear that are healthy for your body, they're usually healthy for your teeth too, for different reasons. Spinach, broccoli, meat is very good for your teeth, like certain meats, the healthy meats, of course, but then it could get into a whole controversial thing. So I'm not a nutritionist in any way, but obviously if you eat healthier teeth, your teeth need vitamins to be healthy. The pulp and the nerves and everything's connected to your gums, and green tea is really good for your gums. Who would have thought? But like, I don't ever get too heavy into diet again or what you're eating, just because the first thing is brushing and flossing properly. And so many people don't do that properly. So you could drink all the green tea in the world and still have unhealthy gums because you don't brush and floss properly. You know what I mean? So like, of course, like there's things that can add to your dental health, but in my opinion, nothing replaces brushing and flossing. You can't just eat apples every day and be like, I'm healthy, I don't need to brush and floss. I know none of you here are thinking that, but I do get a lot of comments, like kind of spammy comments, but sometimes I wonder if they're real on YouTube, saying like, I don't brush my teeth because I eat apples, or I don't brush my teeth because I don't eat, or I only eat meat. And I'm like, meat, although sure, it's not known as a cavity-causing food, meat stuck between your teeth will cause a cavity and will cause gum disease because you have gunk stuck there, and it's going to it's going to aggravate the gums. So, sorry, that was a very long answer as to, no, you don't need to take any vitamins or supplements or probiotics or any of that stuff unless your dental provider tells you otherwise, because you have a certain issue that is you're dealing with, or maybe for a short amount of time they want to do something for you. But for generalized advice, no, don't worry about any of that. Brush, floss, eat as healthy as you can. Someone says, I have braces. You go, girl. It's going to be so worth it. We love braces. They're so worth it. I have a lot of braces videos too. Like I said, if you ever have a specific video or topic that you are wondering if I covered it, of course ask it here because I can give you like a more personalized answer. It's still going to be generalized, but you know what I mean? Like I can give, like if you ask it in a specific way, I can answer it versus you watching my video and having to pick it out, right? But I have so many braces care videos, just like search braces, teeth talk girl, type that in, braces, teeth talk girl on Google or YouTube, and I'll give you some good braces tips, because when you get those braces off, I'm sure you or your parents or whoever's paying for it, you want to make sure they look good when you get them off, because you put all that money and all that time into your braces. So be sure to keep them clean so when you get them off, they'll look beautiful. What is your zodiac sign? I love it. That's so fun. Or big three. I don't know what big three means, but I know my zodiac. I'm a Virgo. Shout out September birthdays. September 15th. Eugene, love your channel. Thank you so much. No, truly, I'm like going to cry because it's very nice. And the reason I make these videos is for all y'all. And thank you for being here, that we can all do this together. If you ever want specific video topics that I haven't covered yet, please DM me on Instagram at Teeth Talk Girl, and I will make a full video. I love doing a book report. If it's something I don't know much about, I'm going to search it. Here's my typing. I'm going to search it so I can answer your question, give you the best evidence-based information from the dental world. I always think about that. Like, we can all Google things. Like, for skincare, I'm always Googling. But I'm like, I don't trust my own Googling because I don't know dermatology. I'm not a dermatologist. I don't trust what I'm Googling sometimes with teeth. I definitely trust what I'm going with. I don't trust what I'm Googling with skin. So I love when I see a dermatologist or a healthcare professional, you know, that works with skin, telling me the answers to things I've been wondering about, because it just validates it, right? So if I can do that for you with dental, just let me know. Okay, and let me see what we got here. Okay, Vales, I have one single baby tooth left, but it's covered by a crown. Okay, my dentist and ortho are talking about either extracting that tooth before braces or not. What's your opinion on this? Please answer. Well, honestly, I don't think my opinion matters, because like without me seeing your x-rays, like if I was your dental hygienist and I was like in on your case here, I'd be like looking at your x-rays, looking at your perio charting, looking at, you know, wondering how old you are, and looking at the level of the bone around the baby tooth. I'd have so many things to take into account to be able to answer that question. So I think my best advice is, you said your dentist and ortho are both talking about it. They're talking about either extracting that tooth before or after braces or whatnot. I really think the two of them talking together will make a great decision for you. If they're going to have you choose, what I would do as the patient, I would say, what would you do? That's what I would ask. So like if they're like, you can do either, what do you want to do? I would go right back to that dentist and say, okay, you're a dentist. You're giving me the option. What would you do if it's your mouth? That goes for all of healthcare. If a medical provider, a dental provider, some kind of healthcare provider ever gives you the option and they give you 2 things or 3 things, I would always say, what do you think's the best option? What should I do? And then they might go into a further convo of like pros and cons and why one person would choose this and why they would choose this or not, you know. So it's just such an individualized question. I'm sorry I can't help you more, but I hope that helps you, giving you that information. Okay, I can only fit the floss. Okay. We got a few more minutes though. We can still keep going. Let's keep going. I can only fit the flosser between my front teeth. What should I do? When you say flosser, it makes me think like a floss pick, like those little floss on a stick. Is that what you're talking about? I'm going to assume. If it only fits, what did you say? Fit between my front teeth. Okay. I would say, sorry, I had to like think about that because there's just so many. I would say use it where you can and then find something else that fits between all the other teeth. There's so many different brands of floss and floss picks. Yep, that's the floss I just used. It's just sitting there because of the garbage. I didn't want to. There's so many different floss and floss picks and interdental brushes. Those little pipe cleaner looking things. Water flossers. You know, water flossers are great if you really are struggling getting anything between your back teeth. Use a combination of whatever works, just as long as you're cleaning between every single tooth in your mouth. You don't want to leave no tooth behind, right? Like, I had a patient recently who I told this to him. He was like, his gum disease was just so bad on the back, the farthest back tooth behind it, where there's no tooth behind it, like the farthest back tooth. And he just had like these gingival issues. And I said, hey, everywhere else looks fine. Why is it only behind those farthest back teeth? And I said, are you ever running think about a string floss? All back there, all the way, wow, I should always have this prop right here. All the way that farthest back tooth, you should still run the string back there or a water flosser. And he's like, oh, I didn't because there's no tooth behind it. So why would I? And I was like, you know what? Good point. I need to start telling people to make sure they do this. So all that to say, brush and floss and just clean every single tooth in your mouth best you can with what you can. You might need to use different products, waxed versus unwaxed floss versus a lot of it's trial and error, and just got to find what works best for you. Hope that helps you. Tips for braces, my girl. Yes, no, like I said, tips for braces. I have so many really great videos that give you step-by-step instruction on how to keep your braces clean. You could just type braces, teeth talk girl. But until then, I will say you need a water flosser and you need an electric toothbrush. An electric toothbrush because you want to brush your teeth twice. Imagine your brackets are here. You want to brush the gums on top and then brush underneath. So you want to do you almost got to brush your teeth twice because you got to brush above the brackets and below the brackets. An electric toothbrush makes that so much easier. Cleaning between your teeth with floss is going to be hard. You can do it, and I do recommend you do it. But in addition, a water flosser can just spray it, do such a good job. Those little proxy brushes. You want to use a bunch of stuff when you have braces. You really do want to invest in your dental home care tools, all the stuff you use in your bathroom, because like I said, you want those pearly whites to be beautiful when you get off. You don't want all these yellow spots because you didn't clean around them well. So be sure to check out that video of mine, but hopefully this gave you some good tips on what you should be thinking about before then. Okay, dokie. Someone said, holy cow. Holy cow. I almost told a silly story about a cow. Well, it's not about a cow. It's about mooing. Moo. Is it truth that a tooth remineralized? Jeannie, yes. So remineralization of a tooth is very different than regrowth of a tooth. So a tooth is made up of enamel on the outside. This enamel is not living. It's just there, right? It's not the live portion of the tooth. So it can't regrow, right? Like bones, if you break a bone, you put it in a cast and you let it heal and it regrows. But the tooth enamel has no live tissue in it, only inside of the pulp. Like you got to go through the dentin and in the inner part of the tooth it's alive, but the outside, that enamel is not alive. So it can't regrow, but it can remineralize because there's so many minerals up in your tooth enamel. And when you use things like fluoride toothpaste, it does this thing and it goes, I'm trying to like say it like how I would tell, because I know there's so many ages in here. So like depending on your age, and like usually when I'm talking to my pediatric patients, the kids, I always say like, so then these like fluoride from your toothpaste, these little ingredients, they get up in your enamel and they like build it up and they make it stronger than it once was. And it's really good. So yeah, they do remineralize. Tooth enamel can remineralize. So it's a great, awesome thing that we can do. It can't reverse a cavity, but it can prevent a cavity from forming. So sometimes when your dental provider tells you like, hey, you might have a cavity starting here and they're not sure, or it's like really close because like, right, it's your enamel first and then your dentin. And like once it passes that line between the enamel and the dentin, that's when you know you have a cavity. So sometimes on the x-ray, if it's just up in here, it didn't go down here yet, maybe we could just remineralize that area since it's technically not through. It didn't go through yet. So yes, Jeannie. Yes, yes, yes. Oh, well, I was hoping to bake everything with xylitol guilt-free. Oh, I'm sorry. Okay, so here's the thing. one more thing about xylitol. It's super, super like unhealthy for for dogs. Don't ever let your dog eat the xylitol. It's kind of like chocolate. Just fun fact about xylitol. Also, oh, the moon is so bright. I got very distracted again. I thought it was from my ring light, but no, that's the moon. Be careful with that. And also, if you eat too much xylitol, it can hurt your tummy. So be careful with xylitol. Don't overdo it. I love xylitol, and it's very good for your teeth. The mints, the gum, any type of xylitol mints or gum, really good. But when you're really, really ingesting it, be careful, don't eat too much. And honestly, in my opinion, I would just use it with whatever or bake with whatever you usually bake with, because you're going to have to brush your teeth anyway. So, but I love that question. You're so cute. Never be guilty. It's the holidays. We're allowed to splurge and eat what we want every day. As long as we brush and floss before we go to sleep, we're going to be okay. Let's see. Someone said, what's the best way to treat swollen left face cheeks? Have TMJ history. Just recently had tongue posture issue where the tongue constantly, oh, where'd it go? Where the tongue constantly what? Where did it go? Oh, there it is. Where the tongue constantly touch the bottom back left tooth. I have a tongue posture issue as well, and I have to keep reminding myself to keep my tongue at the roof of my mouth, at the palate. It's hard. It's hard. There are like different myofunctional exercises you can do if you see a myofunctional therapist, but it's tough. It's like any other workout. Who would have thought working out your tongue builds you up? You sweat. I sweat. I'm like, okay, I remember. I have to do all these things. Okay, so what your question though is, what's the best way to treat swollen left face cheeks? Wait, why is your left face swollen? You have TMJ history, so I think you were saying you have like TMJ disorder or like some kind of discomfort history, or it came out of the socket, you know, how your jaw can pop out. I don't know what your history is, but you just recently had a tongue posture issue where you keep, so I'm thinking you keep going like that, like something like that. You keep doing that and it's hurting your jaw, and it's making it worse if you've had jaw issues in the past. Okay. I'm picking up what you're throwing down. I got it. So your left face is swollen. I still don't, the best way to treat it, I know everyone hates this answer, but I would call your dental office and ask them to take a look just to make sure nothing else is going on. A swollen face cheek is not as common from like doing that with your tongue. I want to make sure you don't have any tooth issues in the back for your face to be getting swollen. You know what I'm saying? So I would definitely call your dental office, get an x-ray, make sure nothing's going on with your teeth first. And then of course, anytime you're swollen, putting ice in that area helps. But first, make sure there's not something else going on. Because if you're just putting ice and there's some kind of tooth infection, then that's not going to help. You know what I mean? So check with your dental provider first. And then they just say, yep, it's from your jaw problems. Ice helps if it's swollen. If it's not swollen and you just have pain, oftentimes the reason we have jaw pain, it's usually not due to the joint. The joint is the temporomandibular joint. That's the TMJ. It's usually not due to the joint bones. It's usually due to the muscles. If everyone right now who's in here, you take your 2 fingers and your 2 fingers and you put them like right there, like right in front of your ear, and just like press, and then like go down a little and then up. Do it right now. And then go like up at the temples. If that hurts or feels good, one of the two, you probably are clenching or grinding and your muscles are just sore. Think about like lifting weights at the gym every day. You're just sore. If you don't feel nothing, you're like, okay, nothing's happening, then your jaw's probably fine. But if it feels good or sore, if you're touching it, you're like, ow, then it's really sore. Or if you're touching it, you're like, yeah, that's nice. Then one of those mean that you probably do clench or grind your teeth. But yeah, doing those like little massages, pressing, like tapping up and down, you'll just feel around. I sometimes like one finger in front and one finger behind the ear. Just press and see if it feels good. Like, I love it. It's so good. My patients, when we do the oral cancer screening, right? Like I check the inside of their mouth, their tongue, and then like I go like around that. I have them open and close and open and close. And when you're pressing, you can hear if you have popping in either ear, like press and open. Do you hear popping? If so, might have jaw issues. If not, you know, it doesn't mean either way. It's just kind of a fun thing you can do, but definitely massaging's good. I hope that helps you, but please go see your dentist. Like, until then. You know what I'm saying? You know what I'm saying? All right, let's see what we got. I got a few more. Oh, I got like 5 more minutes. Let's see what kind of, got a few questions. We got a few questions. Someone said I'm not answering, but what's the question? Let's see. I thought I answered your question, Vales. Did I not? I swear I saw it. Okay. Vividly, are you supposed to, or is it safe to only spit and not rinse with water for any kind of toothpaste? Long story short, a lot of people have been talking online. It's been like a trend that they brush with their toothpaste, they spit, and then they don't rinse. And like everyone's saying, that's what you're supposed to do. You can do that if you want, but you don't have to. I hope that answers your question. If you want to spit the excess, you could scrape your tongue. You could spit, so that if you want the toothpaste to stay on your teeth, great. If you don't, because you're like, that sounds disgusting and I have a texture issue and that's going to freak me out, I get you. Don't worry about it. If you have a cavity issue or sensitivity, or depending on the reason you're doing it, maybe get a mouthwash that does what you wanted it to do. Like if you're keeping the toothpaste on your teeth because you have sensitive teeth, it might help. It might. You never know. There's not much research saying yes or no, but it could help. But if you're like, heck no, I hate that feeling of the toothpaste on my teeth, but I'm doing it because then spit it out, rinse with water, who cares? And then use your anti-sensitivity mouthwash. Swish with that for as long as it says. Spit, and then don't rinse. Then you're getting the same idea, right? It's the same idea. The anti-cavity or the anti-sensitivity mouthwash or whatever you were wanting to get done with the toothpaste, get it done with the mouthwash and you'll be just as good. Unless your dentist or dental hygienist tell you otherwise. There are some prescription strength toothpastes that do recommend you keep that stuff on your teeth. But for the over-the-counter, when we're going to the store and just buying toothpaste, it don't matter either way. Hopefully that helps. How to floss having braces. I have a whole video on that. If you just search braces, just because we're running out of time here, braces, teeth talk girl on YouTube or Google, and it'll pop right up. I will tell you really quick, it is hard, but once you get the hang of it, you'll be flossing with braces in no time. There's so many different cool tools you can use. You can use like super floss when it's like a piece of floss, but on the one end, it's like a hard piece right here. So it goes right through your brackets really easy. There's water flossers. There's interdental brushes. There's so many options to make flossing easier with braces. So please find an option that works for you and don't skip it because it's hard, because you're just going to be so mad at yourself when you get your braces off if you have cavities and stuff. So find something that works for you, and hopefully my video will help you. Okay. Let's see what else we got. Why are people yelling at each other? Who yelling at each other? Don't be yelling at each other. We all in the club, in the club. We all fam, right? In the club. We all fam here. We all dental fam. We're all doing the best we can. That's all we can do, right? Let's see. I'm a carnivore, so that could be what's aggravating my gums is meat in between my teeth. So you're right. Yes, girl. Meat between your teeth. Always people like that's like everyone says popcorn kernels. Like there's of course a bunch of stuff that gets stuck between teeth, but nothing like meat. You should see the meat I find in people's teeth. I don't want to gross anyone out, but it doesn't gross me out. It's actually very interesting to get it out because then we can have a conversation about why that was still there after how long it was there. So, I am beautiful. Someone said that. Yes, you are. You are beautiful in every single way. Words can't bring me down. Can you imagine everyone just logs off because they heard me singing? Unsubscribe. That would be so sad. I don't sing. It was just for funsies. Okay. I'm going to answer one more question. Let's see. How to get rid of bad, here's a good ending question. How to get rid of bad breath coming from throat, as well as someone said benefits of tongue scraping. I can answer those both in one. Okay. So benefits of tongue scraping, I will first say the best benefit is it can improve your breath. If you have any type of bad breath, it's something like 90% of bad breath bacteria in your mouth is found on your tongue. So like scraping that off. I'll have to bring props next time so we can really prop. That'd be fun. Like brush with me live or something. Would you like that? Like if I brushed live or flossed live, that could be fun. Maybe we'll do that next time. And then like also do a Q&A. Anyway, so yes, benefits of tongue scraping. There's a million benefits, but the main one is reducing, the amount of bacteria in your mouth that could be bad and smelly and stuff like that. So scraping it. And then that goes into the other question. Oh, I saw we got one more page question. I'll do that really quick too. Thank you so much. I didn't read it yet. And then, so yeah, if once you're brushing, flossing, tongue scraping, you got a cleaning at your dental office routinely and you're still having bad breath and it's coming from your throat, then we got to decide what's going on. Like to get rid of it, we got to know what the cause is, right? And oftentimes it's tonsil stones. Y'all heard of tonsil stones. Those are all over the internet. We, you know, you could really see back in my throat. I know how to, you can see it'll be on the sides. It's a little, I have a video on that too. You can Google tonsil stones teeth talk girl and I explain what they are and all that. But gargling with warm salt water every night. Gargling, warm water. Sometimes I don't even use salt. I just gargle just to prevent it, right? But in that same sense, it can not only prevent it, but it can also get rid of it. It can loosen that bacteria in the back of your throat. If bad breath is coming from the back of your throat, something else that can cause it is, we said the tonsil stones. It can also be like stomach issues. Maybe you need to see like a GI specialist, see if you got any stomach issues. It can also be from allergies or sinus infections, or like if you have some kind of, you know, post-nasal drip, that can add to a smelly back throat. So just, it's hard. It's kind of like you got to like weed everything out, figure out what it's not, and then that leaves you with what it might be, what might be causing the bad breath in the back of your throat. So hopefully that kind of answers you. But tongue scraping is something that can help too, because brushing, flossing, tongue scraping, all that stuff can help. Okay, so I hope that helped you. Okay, Ryan Brown, thank you so much for your support. That's really nice of you to send that over. Whitney, when I was a teenager, I had a dentist scream at me in front of an entire waiting room. I had braces and he wasn't happy with my brushing. Excuse me? I pressed heart, not because of that, but just because thank you for sharing this really sad story. I don't like anything about that. I'm so sorry. First of all, we shouldn't be talking to patients in the waiting room like that. The waiting room, other people are in there. If he wanted to one-on-one talk to you, not that it's okay that he yelled at you, it should have been one-on-one in the op, like just you and him and your parents or something. So that's the first red flag. The second red flag is yelling at you. No one should feel shamed. You had braces and he wasn't happy with your brushing. Like, I don't know. That's just not the way I look at things. Like, I would never scold someone because you're not doing a good job at home. That's not it. I'm here to help you, right? Like, I'm so sorry you didn't get that kind of bedside manner from your dentist. What you should have had. You deserve good bedside manner. They just, you know, I'm sure he wasn't trying to be mean, but it came off mean. I'm not standing up for him. He didn't handle it right. Communication 101. But in the long run, he wanted you to have better teeth, hopefully, but he didn't handle it right. When I have a patient who has oral hygiene issues, they have poor oral hygiene, especially in braces, I talk with them. I say, hey, you know, like, I want your teeth to look beautiful when you get these braces off. Let's talk about how you can improve at home. Like, that's how you should talk to someone. You shouldn't yell at them. I'm so sorry, but thank you for sharing that, Ryan, because like now if other people have had that experience, they'll know that they're not alone. And so I think that's really nice that you shared that. And I'm really sorry it happened to you. And I don't know. All I can see is that I can't see anything else. How do I get rid of it? Oh, there we go. Okay. I was like, I can't even see myself. As I was answering that, I couldn't see myself. Okay. We're a little over an hour now. So I'm so happy that you all were here with me. Thank you so much. I will tell you, I'm planning to do this again sooner than later. Like I said, I would love to do once a month. We'll see. But I usually do on my breaks for school. But until my next live, you got two options or both. Either one, come see me on Instagram at Teeth Talk Girl and send me a DM. I do those Ask Me Anythings, AMA. I just did that right before this. You could DM me. We'll try and answer, talk with you. Or you should do both. Two, if you ever have a question about a specific dental topic, type the topic in your search bar. Say it's cold sores. Cold sores and then Teeth Talk Girl. Cold sores, Teeth Talk Girl, and a video or article of mine will pop up on Google. So I'm just I'm really here to help provide evidence-based dental health information. There's so much misinformation out there, and I'm really happy to be here to help you all. Someone else just said something. Wait a second. Stumbled onto this live. Amazing. BXES0224. Thank you so much for being here. You just, wow. Okay, what a nice, thank you. Nice, happy thing. You just made me so happy. Thank you. 24. Thank you. I want to just keep answering. I see metal or plastic tongue scraper, whichever one you like. I want to do a rapid fire, whichever one you like, whichever one will work better. Metal can be washed in a dishwasher usually and reused longer. Plastic, you do have to change out every 3 months, just like a toothbrush. Thank you, Whitney. Good luck with all the studies. Thank you, Alan. So I could go on and on. But yes, like I said, any specific dental topic, type it in, cold sores, Teeth Talk Girl. It'll pop up either my YouTube video or my article on my website, teethtalkgirl.com. And I'm so thankful. And at the beginning, I just have one more thing to say. A lot of you, someone asked something, and I know I was saying routine at the beginning because I was like, routine. I kept talking about brushing, flossing, routine. That's everything. You could have no dental bills if you just stick to a routine, right? Brushing, flossing, and of course, visiting your dental office if you can. That is the goal. But what you can for sure do at home, go to the dollar store, get a $1 brush or $1 floss, maybe a $1 tube of toothpaste, $3. You could save thousands of dollars on dental care. And to stay on routine, I will say visit bettermouth.com. They have such a good routine builder. So there's a lot of fun stuff coming with Bettermouth. So I will say, if you're struggling with routine and habit forming, bettermouth.com. If you have any specific questions for me, at Teeth Talk Girl on Instagram. And thank you, Bruce Moose. First of all, I love your name, Bruce Moose. That's fun. Had to drop a sub. I learned a lot. Thank you so much. Share this with a friend if you're into dental health or you know anyone who's interested in dental hygiene, all things teeth. Be sure to share this channel with a friend. We just want to keep providing evidence-based, trustworthy, free dental health information to all. And to all a good night. Happy holidays. Happy New Year. I can't wait to talk with you all soon. Bye. Thank you. Peace, love, and teeth. Thank you so much, everyone. Thank you. Thank you. Oh.